Call the Monday, February 11th, 2019 work session of the Portsmouth City Council to order. Madam Clerk, will you call the roll, please?
Yes, sir. Mr. Battle.
Here.
Mr. Clark.
Here.
Mr. Glover.
Here.
Mrs. Lucasberg. Here. Mr. Moody.
Here.
Ms. Simmons.
Here.
Mayor Rupp.
Here. Dr. Patton, you want to go over the agenda, then I'll introduce number one.
Yes, let me read all of our presentations.
That's fine.
All right, Mayor, Vice Mayor, members of City Council. The presentations tonight, the first presentation, the City Manager will present the FY 2020 Strategic Budget Initiatives. According to the City Charter, the City Manager is required to prepare and submit to the City Council an annual budget. The FY 2020 budget process began in the fall of 2018. In July 2018, I charged the department heads to prepare a written report with recommendations addressing the futuristic process for the delivery of services for their respective departments as we start the process for the FY 2020 budget. I met with each department head to discuss their submissions and how they envisioned the future of their department. The department budgets were submitted on December 14th. The budget team is in its third week of hosting 42 budget hearings. The hearings were municipal departments and constitutional officers had an opportunity to present their budgets. They were developed and based on projected needs and related to the organization's program's objectives and aligned with the City Council's vision principles. Revenue, local tax, and fee benchmark review will be the second presentation. Ms. Gloria Washington, Budget Officer, will present a review of the local tax and fees benchmarking comparisons from the peer cities across Hampton Roads. Members of City Council, it is important for staff to continually review the taxes, fees, and rates during the budget process to remain aligned with the cost associated with providing key services to our citizens. And lastly tonight, as requested by Council, during our January 22nd meeting, representatives from the U.S. Census Bureau were present, and it has initiated a community outreach to participate in the upcoming Census of America population. The goal, according to the Census Bureau, is to count everyone only once in the right place. For the first time in 2020, new technology will allow response online, by phone, or by mail. As part of this effort, Mayor and members of City Council, you requested staff to report back to you on a calendar we will follow to ensure that the city works as a partner to ensure that every citizen of Portsmouth is counted. There are 3 primary areas for the city to participate, including the creation of a complete count committee, which you will be asked to begin to give thought to so that we can form the committee, that will raise awareness through the use of city communications and social media outreach, and finally help recruit census workers. With tonight's report back, the city will begin the process of preparing for this very important process. Mr. Brian Sweat, Planning Administrator, will make the presentation and go over the calendar.
Thank you, ma'am. Last month, we had a presentation by our Sheriff Moore, and from that discussion, Council asked the City Manager to invite representatives of the Hampton Roads Regional Jail to meet with us tonight. And we have the chairman of the Hampton Roads Regional Jail Authority, Martin Thomas, with us tonight. And he's our neighbor. He's a member of the Norfolk City Council, and welcome.
Thank you.
Yes.
So I appreciate you having me and the rest of the team from the Hampton Roads Regional Jail here tonight. We hope to answer some questions, enlighten you a little bit about what goes on at the Hampton Roads Regional Jail. I can tell you, I appreciate, so I've served as the chairman of the board of the jail for a year. I've got 9 more days left in my term. And I appreciate both Mr. Nathan Clark and Dr. Patton for their attendance at our board meetings. They their input is invaluable, and I again appreciate that. I'm here to introduce our superintendent. He's a new superintendent to the Hampton Roads Regional Jail. He was hired this past June. Prior to that, he did a very short stint as our interim superintendent. He was on loan from the city of Chesapeake. And I can tell you, his bringing him on board has been one of the best decisions that we've made as a board, I see that, in quite some time. He's jumped right in. A lot of the concerns that the Department of Justice has expressed, he's attacking them head on, and we appreciate that. What I can tell you about his history is that he started off as an intern at the Chesapeake Sheriff's Office way back in 1987. And he climbed in the ranks over there very quickly. In '88, he became a deputy. In '95, a deputy sergeant. In '01, a deputy lieutenant. In '08, a deputy captain. In 2010, a deputy major. And in 2014, chief deputy lieutenant colonel for the Chesapeake Sheriff's Office. Now he is our colonel and superintendent at the Hampton Roads Regional Jail. What I will tell you is that Colonel Hackworth has the complete confidence of the board. I speak on behalf of myself and the board, and I think that the two members here would agree. We've all been very impressed with what he's done so far, and I will point out that tonight with us also is our counsel, Jeff Rosen, sitting in the back, who's available to answer questions, as well as our assistant superintendent, Chris Wallace, who's here as well to answer questions. But with that, I will yield and allow Mr. Hackworth to come up and do a little presentation on the great things that are happening at the Hampton Roads Regional Jail. And should you have any questions, please let me know.
Sir. Thank you. Mayor, Vice Mayor, members of council, city staff, of course, it's a pleasure to get out and talk about the Hampton Roads Regional Jail. I will tell you that, serving as the interim and having the 3 months to really look at it, hands down, I am very proud of the job that the people are doing there day in and day out. And there's a great staff that's there. That added, Colonel Wallace came, and as Mr. Thomas had said, came in September of last year, and he comes with 28 and a half years from the city of Norfolk with the sheriff's office there. So what I wanted to do was talk to you a little bit about the Hampton Roads Regional Jail, give you a little information of what we're doing there, how things work, and I think there was some information that was presented that I kind of want to clear up and make sure that you've got a right picture on what's actually going on in the jail. So if I start out, the Hampton Roads Regional Jail Authority was actually created back in 1993. And there was a creation agreement and a service agreement that was put into place by the city of Hampton, the city of Newport News, the city of Norfolk, and the city of Portsmouth. This creation and this service agreement brought forth and created the Hampton Roads Regional Jail Authority. So there is no contract. There are these documents. Every city is a member of this authority. The jail actually opened and took its first individuals into the facility March 16th, 1998. A couple years ago, the city of Chesapeake, which I was there at this particular time, we had a situation where we could utilize the bed space, and so the city of Chesapeake went into partnership and became the 5th member jurisdiction there at the regional jail. To let you know part of the service agreement and what we have and the beds and how this is divided up is the city of Chesapeake has 250 beds that they're able to fill at the Hampton Roads Regional Jail. I gave you numbers because I turned the PowerPoint in last week, but I'm going to give you updated numbers from today. So 250 beds for Chesapeake. As of today, they had 247 of those beds filled. The city of Hampton has 175 beds, of which they actually have 159 today. The city of Newport News has 200 beds. They actually had 205 individuals in the facility today. There is a stipulation that the member jurisdictions can go over, and I say roughly about 20%. They pay additional money if they do go over. And so it's not unusual to have somebody who has more than what they're actually allotted here at the facility. The city of Norfolk, 250 beds. Actually, of today, they had 251 of those filled. And the city of Portsmouth has 250 beds with, as of today, 137 actually filled at the facility. So the Hampton Roads Regional Jail Authority is actually comprised of 15 members from the 5-member jurisdictions. Each jurisdiction will have an elected official, will be a member from council, and there's an alternate for that person. The city manager sits on the board, and as well they can have an alternate. And then the sheriff from each of the 5 jurisdictions also sits on the board and can have an alternate. But there will always be 15 members sitting on the board. When we opened the facility, the rated capacity by the Virginia Department of Corrections was 798. I think it's important when you start talking about rated capacity to understand that doesn't mean that all of the cells are actually counted in. There's actually a process to go through, and so there's a certain amount of cells that are not included into that rated capacity when it comes in. There are some what they call temporary beds, multi-purpose cells that are not actually counted into the facility. If you actually look at the number of beds that we have in the facility, we actually have 1,429 beds in the facility. Some of the things that we feature at our facility, of course, there is an intake release area, kitchen, commissary, maintenance warehouse, property. We do have a law library where the individuals that are in the facility can go to do legal research. Laundry area, we have program offices. Every housing unit has training rooms for programs to run. We have a training area. We do have a lieutenant that makes sure all of our officers are where they need to be, that they're attending basic school, that they're doing their in-service. Visitation areas, medical area, as well as the inmate housing areas, and that will be the general population, restrictive housing, medical, mental health housing, all that's in there. We currently house, not only do we house adult males and adult females, and those are individuals either waiting for trial or they've been sentenced. And either they're going to complete their sentence with us or they're going to be transferred to the Virginia Department of Corrections at some point in time. But we are also holding what we call the adjudicated, sometimes you'll hear them say adjudicated adults, adjudicated juveniles. These are the individuals under the age of 18 that are being tried or have been tried as adults that we are housing at this facility. One of the things we did last year was we actually have a special housing unit for them to make sure that we're meeting all the standards of the Virginia Department of Corrections. So we'll get those from the age member jurisdictions as well. The programs that we actually offer in the facility, there's quite a few. I'm not really going to list them all out, but you will see that not only are we providing programming from staff that we consider our staff that we're paying directly, but we also partner with quite a few outside agencies. Whether it's the Portsmouth Public Schools to provide educational services. We also have a strong partnership with the Virginia Beach Justice Initiative. So there's quite a few that go on. Some of these we are doing every day. Some of these are once a week. But we are definitely doing considerable amount of programming inside the facility and always looking to expand. I think two of the things that we're really proud of are the last two. You'll see the CORE grant, which was a grant that was obtained by the regional jail a couple years ago to look at individuals suffering from severe mental illness, to provide some programming for them inside the facility, as well as we partnered with the 4 CSBs that affect this jail to be able to provide some discharge planning for them. And so we're able to provide some basic living costs, housing, medication costs, things like that to hopefully get them back into the community and make them successful. I added the last one, which is the Forensic Discharge Planning Grant. This is something that actually we could not get. It was a grant that was issued by the state. Only community service boards that affected one of the 5 leading facilities in the state with severe mental illness were eligible to apply. And so I contacted all the CSBs, and they worked together. Chesapeake, I think, actually took the lead on this to actually provide more intense and a larger number of individuals from the CSB to provide forensic discharge planning. So that is something new that is coming into the facility, should be within the next month. We're going to have, where the core grant, we have 3.5 people to provide for discharge planning. This actually puts, I believe, 9 forensic discharge planners. And this is from all 4 community service boards to deal with the entire population, to make sure that if we have somebody who's being released from the facility, that there's a good plan to transition them back out into the community. And so if we have somebody that needs services from the community service board, we'll be able to get them out, get them employment, and get them get their plan to actually start in motion. So that's something that will be coming up very soon. The accreditations, I think, are something that really speaks loudly as far as what we do at the regional jail, and I think it's an accomplishment because these are individuals that come into our facility, look at how we do things, and if we're not doing them the way that they're supposed to be done, then we're going to get hit hard on them. So last year we actually went through 3 big accreditation processes. I'll start with the Virginia Board / Department of Corrections. They came in May of 2018. This is 3 assessors that come in for 3 days to check the standards that are mandated by Virginia law for us to comply with. They came into the facility, found no deficiencies with us, and so in July, the Board of Corrections voted to give us 100% compliance. We then went back, and I told you we created the housing unit to house those individuals under the age of 18. So we configured our housing units and did what we needed to do. And so in September, the board granted us the additional ability to house those individuals. In June of last year, the National Commission on Correctional Health Care came in. This is a group that comes in and sets national standards for health care. They came in with 2 assessors. It was a 3-day assessment. We went before the board in August and were awarded accreditation with, and we call it NCCHC, but we were awarded the full accreditation status with the National Commission on Correctional Health Care. We followed that up. I allowed the American Correctional Association, actually I called them and asked them if they would send an assessor in July to come down and just to look at the basics of what we were doing. They do not issue, that was not for certification or for recertification. That was just to see where we were at that particular point. I think it was 2 days with 1 assessor that came in. It was a senior assessor that came in. And I felt pretty good when the assessor came to my office and said, I'm leaving with no concerns at this facility. And so we followed that up. And in November, we had 3 new assessors that came in, spent 3 days at our facility. There's roughly 435 standards for the American Correctional Association certification. There were some that were not applicable, such as we don't have drug dogs, and so they would not apply those standards to us, but we walked out with actually the assessors giving us 100% on that. In January of this year, we actually went in front of their board and were reaccredited through the American Correctional Association. So there's 3 accreditations that we're carrying right now. And we just went through the big assessments last year with them. I'll also note just the fact that we also went through an audit that was a 2-day audit with the Virginia Compensation Board, and we were actually rated the highest rating that they can give us, which was exceptional performance. This is something that does to see how we're tracking the individuals that are incarcerated and making sure that we're complying with how we're reporting them to the state. So I think that was tremendous for the facility. The other thing I think that's really good about this is NCCHC and ACA are not mandatory certifications. They are certifications that we reached out, that they've had at the facility, that we're going to continue to do. I think it holds us to a higher level, a higher performance level. If we didn't have the American Correctional Association certification, then we would follow the minimum training that's required for jail officers in the Commonwealth, which is set very low. 24 hours every 2 years is the minimum of what you would have to do just to keep our officers certified. By going with the American Correctional Association, our officers are receiving 40 hours of training every year. And so some of the things that we're doing, so that you're aware, and it's something new that I've put out, we have a number of officers that have been trained in what we call mental health first aid. By the end of this year, every officer will have gone through mental health first aid. We're also very involved with the CIT programs, if you're familiar with the crisis intervention teams. It's something that, and I think the other part that's important is there are 5 cities that really support this facility here. And so not only do we send people to CIT training in Portsmouth, but we send them to Newport News, Hampton, we're sending them to Norfolk, we're sending them to Chesapeake, and we're putting our officers, as many officers as we can get through the CIT training, we're sending them. So if we get an open space, there's going to be an officer that goes to that training. I think that's worked miracles for a lot of our law enforcement on the street. But those same methods that they're learning in that type of training, we're applying it into the facility as well. All right. The Portsmouth per diem rates. I think you were told that in 2009 it was $30.85. But you were told that right now the cost is $60.45. In reality, the city of Portsmouth pays $64.45. So it's $4 more than what you were told. There was some forecasting of being $120 over the next 10 years. That's not realistic. We are projecting our budget. We are working our budgets out. Actually, from what was projected the past year, we've actually have seen that we can reduce any increase in per diem rates. And I think when we looked and we went out 4 years, and I think that we're doing a really good job financially, we would come nowhere close to $120 per person per day. You were told that there were 5 superintendents in the past 18 months. Actually, there's only been 2 of us. Mr. Myers, who served from March of 17 to March of 18, and then I came in for the 3 months and then took the permanent in June. So there's only been 2 of us that have actually worked as the superintendent. At times, the Hampton Roads Regional Jail can provide a higher level of medical care for individuals than the member jurisdictions can. And so we have a process on how we have to get individuals transferred from the 5 local jails into our facility. There are times when there's a need for that individual to come to our facility. And so some of the examples I gave you is that some of the facilities can't handle somebody who may be discharged from a hospital that has an IV. We can over at the regional. Dialysis. If we're working with one of the local jails and they have somebody on dialysis, many times they have to contract with a outside dialysis center. That's going to cause for at least 1 deputy, more than likely 2 deputies, to go to the facility, get the individual, take them to a dialysis center, sit there with them for 4 to 5 hours, bring him back to the facility where we provide dialysis inside of our facility. And so there's no need to move the individual that's there. There was something that was said, and I guess the question is about the federal government taking over the facility. Everybody has heard about the report that came out December the 19th, 2018. We are currently working with the Department of Justice. This does not result in the federal government taking over our facility. We are in the preliminary stages of that. This is going to be a pretty long process to go through, but it doesn't result in the federal government taking over the facility. I kind of wanted to let you know about our medical services, and I know that if you go to the report and you look, I think the one important thing to take from that report was that it's a little old. And so if you look at a lot of their information, it may come from information that was in 2016, 2017. And so there's been a lot of things that have gone on. So I wanted to give you kind of a snapshot of some of the things that we have in our facility as far as medical services go. Our current vendor is WellPath. They were formerly known as Correct Care Solutions, or CCS. Currently, to provide our medical services, we're at 62.7 FTEs. And just to give you a snapshot, we have a full-time doctor that is there at the facility. We have 2 full-time nurse practitioners that are there at the facility. We have a full-time dentist who is there at the facility. And if you read the report, I think that they said in February of 2017, and you totaled up the medical personnel, it was at 50.8 FTEs. And so you'll see that since the report came out, even up till today, we have added and we've made the medical section a little more robust. Some of the services that we provide on-site at the facility, we do physical therapy, optometry, OB/GYN clinic, nephrology, HIV clinic, dialysis, chronic care, and dental services. And so those are just some of the ones that we're providing on site. I also wanted to kind of go, because there was some comment about taking 14 days to see medical, and sometimes it had taken 20 to 27 days. So I wanted you to have a feel of how our services actually work at the facility. And so if we're talking about the intake process, which is somebody new coming from one of the 5-member local jails and coming to our facility, they don't come into our facility and we just house them away. We are starting the day before they actually find their way here to the facility, or to the Hampton Roads Regional Jail. And so at 2:30, the day prior to an individual, there is a conference call that our medical provider has with any of the jurisdictions that are sending individuals to us. They identify medical diagnosis and any needs that it can include things like wound cares, fractures, outpatient appointments that may be scheduled. Because if they're scheduled, we don't want to bring them in and say we didn't know about it. We make sure that they continue to get to their outside appointments. Any medical equipment that's needed, increased monitoring for issues for somebody that may be under suicide watch. So all this is discussed the day prior. In addition, we're also getting medical records from those individuals as well. The morning of that the individual is going to come, we actually have this, and it's pretty detailed, and I have never seen it at any of the jails, but we have what we call is a whiteboard meeting. And this starts at 8:15. It is every morning, Monday through Friday. The diagnosis and needs of each new admission are discussed in this meeting. And this meeting includes quite a few people. And this is where we're making sure that we're on the same page together. We've got security staff. We'll have a member of our command staff there. We've got leadership from medical. We've got the healthcare providers. We'll have the charge nurse. We'll have the clinic LPN, mental health director, and so there's quite a few of us that go around. Not only are we discussing everybody who is coming into the facility, but we're also discussing what medical appointments do we have. We discuss anything that we may have. If we have somebody who may be on a suicide watch, we're looking at them. If we're looking at somebody who may have missed a couple of meals and be going on a hunger strike, we're looking at those individuals as well. So we are constantly going through and evaluating what we've got going on in the facility, who's coming into the facility. And as I told you, it's a comprehensive meeting to ensure the needs of each individual are met when they arrive at the facility. We have a full-time registered nurse who was assigned to the intake area. And so that person does a considerable amount of screening. And I guess maybe I should go to this slide because I kind of did it. So the RN assigned will do all the intake screenings and utilizes an intake checklist to ensure that all the tasks are completed on this individual. Initial labs, chronic care visits, PPD plants, as well as when they're going to be read, annual PPDs, annual health and physical, chest x-rays, ultrasounds are all scheduled during our intake process. Additionally, we also have a requirement where there has to be what we call the brief mental health screen. This is a requirement that all local jails and regional jails are required to do. So this is also done in the intake area. If it appears that we have somebody that may be going through some type of a mental health crisis or some type of a medical crisis, or they're compromised in some way, the registered nurse that's assigned to that area will immediately stop and will consult with our healthcare providers. And so a lot of times we have one of our nurse practitioners, usually it's the doctor, who will come from our medical section, come down, will evaluate the individual. We have had cases where we've had individuals, even though they're transferred from another jurisdiction, that upon our review, the doctor has decided to send those individuals out to the emergency room. And so this happens every day that we've got this nurse in here doing this critical intake. The second part of this, and so that's the initial when they come in, but we also have our sick call process. And so there's a question about, how quick does somebody get in there? Well, we take sick call requests at least twice a day during medication pass. Every sick call request that we get is going to be triaged within 24 hours by a registered nurse at the facility. And this is required by NCCH standards. If we happen to get somebody that has a sick call request and it is a more what we consider serious medical issue, they are seen immediately by a healthcare provider. But if it's something where somebody may be complaining about a cold, it's something that's going to be triaged within 24 hours. And so I told you, if based on that, either they're seen immediately or they're scheduled to actually see the provider. So that's kind of a nutshell of a little bit of our processes. All the member jurisdictions, and I tell them, if anybody wants to come and wants to go through the facility and look at the facility, I would more than welcome any of the council members to come and to walk through and to ask questions.
Thank you, sir. Questions?
Elizabeth, and then I have one.
Elizabeth? So,
Colonel,
here.
back to the very front of your presentation when you showed all the cities have, each city has so many members currently there, or you've had numbers and updated. It looks like, yeah, that one, there you go. It looks like all of our neighbors are at, 90, 100% or more, and we're way below the chart. Is that typical of the last year that you've been there?
I would say typically Chesapeake, Hampton, Newport News, Norfolk, usually Chesapeake and Norfolk usually hit 250 right on the mark, because what I do want to say is, if you've got 247 today, tomorrow you could have 253,
Sure.
And if you're paying for 2 days, it equals out. Hampton and Newport News usually runs a little bit above. Hampton is, sometimes they're a little bit below, sometimes they're up above. Chesapeake and Norfolk usually hit right on the mark. And Portsmouth, I think, has regularly had a number of open beds. Not that many.
Yeah, so if you have 1,400 odd beds, and I total up all of that, you got a lot of empty beds in addition to, but still.
We do have some empty beds, yes, ma'am.
I mean, that's 750. I mean, that's not 1,000 beds. If all 5 jurisdictions were at 100%, you wouldn't be at 1,000.
If
Right.
if everybody was at the If I was there, yeah, I'd be a little bit over 1,100.
Okay, so you'd still have some more beds available
Yes, ma'am.
if you have 1,400 some. But that includes, some of those have to be for the dialysis people and the,
Well, dialysis, the housing of where they're at makes no difference, because what we do with those individuals is we walk them down to the medical. We have a room with the dialysis
So
chairs
it's
and
not
the
a
machines.
special area.
It's not a special housing area for them, no.
thank you.
Okay, we'll go to the Vice Mayor.
Yes, Elizabeth, we had the same idea in mind with the bed numbers that are there. And I know when the sheriff was here, he mentioned about renegotiating our contract. I know that if you look at these and our city size being 95,000 population, you know, should that be somewhere aligned with, I don't know how they came up with the numbers for 250, you know, for each capacity region that's there. And second part of it, you did a great presentation. I'm glad you stuck it out long enough to come and to present to us. For the 3 years that I've been here, I've not received this information, and you presented it very well. So thank you for being here tonight.
You're welcome. Thank you.
All right, Shannon.
Yeah. How you doing, sir?
Good, sir.
Good. Good to see you. Thank you for coming and thank you for all your hard work, you and your team. One of my questions is, you've been on the job for about a year, right?
10 months. Yes, sir.
10 months. And so the report that I read from the Department of Justice had a whole lot of serious concerns in it. Would you agree?
Yes, sir.
It had a whole lot of concerns in it, and safety concerns were included in that. My question to you is, listening to your information, you really hadn't addressed a lot of the safety concerns. I know you guys are making improvements, but those things that happened that created those environments for the Department of Justice to come in there and do their review that they did, those were things that were prior to your watch.
Yes, sir.
Are those things, can you say with a high degree of certainty, I know you're moving in the right direction and that's commendable, is the environment that created the situation that required the Department of Justice to come in there to review the jail, are those things being worked on?
I think we're constantly, I think the concerns that are in the Justice Department report, as well as concerns that I just have as coming in as the new superintendent, we're continuously addressing. And some of those, you know, we came about, we looked at our staffing and how we were getting individuals. That has drastically increased. I mean, we're doing much better with that. When I came in, I think there were 38 vacancies. Now I think I've got 10, and I'm looking at I think I've got about 19 polygraphs that are scheduled, which would be the final phase. So we're staffing the jail. We've got the vacancies filled. I think we're continuously looking at processes that come through. I think that's a constant thing of whether this Justice Department report was here or whether it wasn't, that if you're going to be effective in running a facility, you're constantly looking at how you're going to improve. And I think it's the point that if I said I was going to stay until I thought we were where we would need to be, I would be here. I wouldn't be retiring because I am constantly looking for improvement. I think Colonel Walls, both of us have, you know, we're boots on the ground. We're walking, we're talking with individuals, we're reviewing policies, procedures, we're looking at administrative things. So I think we're addressing all that and more.
Bill.
I know you say there's a creation agreement, but no service agreement.
There is a service.
It's a service.
No
It is a
contract,
service.
I'm sorry. When the sheriff was making his presentation a week ago, a couple weeks ago, I'd asked the question, why do we have to pay for bids not being utilized? And how can that be changed? And the reason why I ask that, if the sheriff is not comfortable, let's say for the DOJ report, not sending inmates there, not only our sheriff, any sheriff, why should we have to pay for unfilled bids? And how can that be changed?
Not a true expert, have read through the creation agreement, have read through the service agreement, read through the bylaws. You know, that's an agreement that was made like I said, 20-some years ago. My understanding is changing of anything that would go into the service agreement and changing of numbers would have to be something that would have to be approved by all the member jurisdictions.
It's an authority.
Do you know whether that issue has been brought up during your tenure?
That has not been brought up during my tenure, no, sir.
Can we get it on?
And I don't know that if it really came to that, that's more of the authority and those 15 members that sit on the board that would really have to direct that, to even start that process. I think that would be a board action rather than me as the superintendent being able to do anything.
I think that's something that needs to be addressed down the road, and I hear what you're saying. That's up to the members, not you specifically.
I serve at the will and pleasure and of the board, and like I said, I think that's something that would have to come through the board for them to act. Or
Okay, thanks.
Thank you. On your medical evaluation protocol, when the intake nurse is there,
yes, sir.
that nurse is actually meeting with the new prisoner.
Yes, sir. So there is a medical room set up
Very
right
first
in the intake area. So when the individuals come, that nurse is there, bringing them into the room, doing the screening, doing a PPD plan if that's what they need to have
So
done.
From day one, they actually are with medical.
Yes, sir.
Okay. If I did my calculation correctly, unused capacity, you've got 304 bids above the sum of those numbers next to each city. Is that about right?
I think
Come up with 11,000.
Oh, with the bed count, yeah. The actual head count, if you add that up, and it won't come up to what I tell you my head count is going to be, which is 1,002 individuals as of today. If you add that up, it's right under 1,000.
No.
But I've got
The left-hand column
left hand. Yes, sir.
adds up to be 1,125.
Right around there. Yes, sir.
You have bids of 1,429, so you've got unused capacity of 304.
Yes, sir.
Okay. Having been present at the creation of 2 regional jails in Virginia, I can tell you that the take of pay is established by each jurisdiction, not by the authority. When you go to the table, you say, I need 250 bids. So at some point in time, the city of Portsmouth said we needed 250 bids. And it's on that basis that you build your budget, which includes both the operating and maintenance cost and the debt service. Do you have outstanding debt?
We do.
Okay. If one jurisdiction goes down, that means that the difference is going to be picked up by all other jurisdictions. That's just a point. And so,
No jurisdiction will pick up.
again, this is a partnership that we're in, so you got to get your other partners to agree. They've got to agree to something that's counterintuitive, that their per diem is going to go up. Their cost is going to go up.
It does seem strange, though, that we would have ever, I mean, it's water over the dam, but that we would have ever thought that we should have the same number of beds as Norfolk, for example.
Or Chesapeake.
But you have to look at the circumstances at the time. You know, the state might have been breathing heavy on Portsmouth's neck about the conditions at our jail.
Crowding.
And it was
Yeah.
probably overcrowded.
Yeah. Nate, you,
Yeah, it was. I mean, the population of the jail, even when I worked in there back in the 80s, we actually had a company had to come into the city jail and double bunk the cells. And even after they did that, we still had mattresses lined up on the floor with people sleeping on the floor. And that was the entire jail, all 8 floors. And that's how overcrowded it was. And that's just changed through the years. So I'm sure when this was done, there was no doubt that those 250 beds were needed.
now, I have another question too. Since the opening in March of 1998, have there been additional pods built?
No, sir.
So what we see today was all built in 1998.
To the best of my knowledge, yes. I don't know that there was
That's
any
fine. I mean,
construction.
That's good. You don't have to qualify.
Yeah, I would say there has been.
There's been no.
Okay. My point where I'm going with this is that it was built to the then standards of the Department of Corrections for Virginia,
Yes, sir.
compared to our jail, which was built in the 60s.
1960.
The standards have changed in 30 years from the 60s to the 90s, I would imagine.
They have, sir.
I know they have.
That's a good thing.
Yeah. So in the final analysis, your facility, which is really our facility because we are members, is a more modern, up-to-date, and more to standard than our current jail that's now more than 50 years old.
Without going into the Portsmouth jail, I would say on that, yes, sir.
Any other questions?
I want to comment that, first of all, thanks for coming tonight, because Dr. Patton and myself, we attend and we're part of the board. So we do hear at the regular meetings of all the good things that are happening there, and unfortunately, most of everybody hears what's on the news and everything else is all the negative things. And, like it's already been, the superintendent has shown us that report, even though it came out in December, the investigation was a long time prior to December. And all these accreditations have happened pretty much in the last year. So if any of those concerns that existed when that investigation was done, there's no way that these 3 accreditations would have been received by the facility. So, the investigation was in the past, and it was a delay from their investigation when the report came out in December. But based on everything that we're apprised of at these board meetings and all of those accreditations and being at 100%, there's no doubt in my mind that any of those concerns addressed in that Department of Justice report have been corrected, or those accreditations would not have been received.
Good point. I have one more question. Is it safe to assume and say that the regional jail gets the sickest of the inmates of all 5 jurisdictions?
Yes, sir.
If you're the local sheriff in Hampton and you got somebody with stage 4 cancer,
They come there.
you want to give that inmate to the regional jail. If you've got a woman that is pregnant, you want to give that prisoner to the regional jail. Is that typically what happens?
That's a lot of the individuals that we get. And of course, every sheriff has has their priorities set a little bit different. And like I said, there are some cases that we can deal with things a little easier. If we have an opiate addicted pregnant female that comes in, we're very used to having individuals like that. So it wouldn't be uncommon for somebody like that to be transferred over to us. And like I said, we've got just medically, we do have a little bit more robust staff than most of the local jails do.
Dr. Patton, you had your hand.
I was going to just speak similar to what Mr. Clark said, is that every board meeting, the superintendent staff gives a detailed report to the board in every area of which there are directors that are representative, down to the point that they report how many pregnant women they are, what's the condition. We get no names, but they're just giving us the jurisdiction, because some of them are our people, some could be Hampton, we don't know names, but they are citizens of the 5 who are a part of the authority. In addition, we get a detailed HR report that keeps up with his hiring practices, where they are in their career fairs and their recruitment. Every piece, total budget update, every piece of that regional jail is reported at every board meeting and given an opportunity for each board member to ask any questions as it pertains, no different than before this superintendent came and we had the last superintendent. I asked the question about Medicaid coverage for inmates. I was brushed off and told inmates can't get Medicaid. I knew they could. but I was brushed off. And we've reported back to you all how the jail has gotten the inmates covered by Medicaid and how monies have been saved, whereas they could have saved it going into the hospital during the time there's an overnight stay. They didn't do it, but now we're doing all of those kinds of things that are cost effective.
Good.
But we've got a superintendent who listened and put it in place 2 weeks after he got in the position.
Shannon?
Sir, you had indicated prior to your coming to the jail and your leadership role that your medical staff wasn't up to the standard that you felt it should be. Was that correct? Is that what you said earlier?
No, I said if you went back to the original Justice Department report, you would look, I think they said in February of 2017, we were at 50.8 FTEs. And since that day, and that even goes back prior to me, we have added people to that medical staff. And as of today, we're at 62.7.
Right. You've improved that outcome. So I guess my point is, prior to you coming, though, a lot of the reporting was that I had read was the fact that that jail receives a lot of folks that are sent there with mental health conditions. Is that correct?
Yes, sir.
And so those people that are coming there with those mental health conditions and then not having this was probably prior to you coming, not having the proper mental health professionals in place, that could present a certain situation, could it not?
If they weren't in place, yes, sir.
Okay, that's the question.
As a representative and a policymaker for the city of Portsmouth, that is basically my interest here. And what I'm asking you to possibly research and convey to Ms. Manager is those things that would give us a greater variety of flexibility in our union or marriage with the areas such as us being able to possibly back away from what we have and send a rational number to you guys of beds that we're really going to need and not waste the funds of a city like ours. So if you would, please investigate that and see how it can be done where we can kind of redo our marriage and have greater flexibility to get you guys.
Any other questions?
I'm just curious, the mental health, I think I read somewhere in the media this weekend that they're not segregated, or how they separated persons with mental illnesses versus opioid persons versus HIV persons versus all of the other conditions that.
Well, I think that's one of the big things that we're doing, and I can't say what was done prior to, but just because somebody may have HIV doesn't mean that they're separated from everybody. Just because somebody has some type of a mental illness doesn't mean that you need to separate them from, not because of their medical condition or their mental health diagnosis. If somebody needs to be separated out, and we have a system of classification between minimum security, minimum, medium, maximum security, which goes into a variety of things. Their mental health diagnosis or their medical diagnosis will not play into that. Of course, unless you have somebody that has active TB, we're not going to put them in the population. A lot of it is based on behavior. On how we move individuals and where they may be housed, but we do have a housing unit designed for some of our individuals with severe mental illness. It is not a lockdown; it's just a housing unit where we put those individuals. It's easier to manage them. It's a regular housing unit per se. We do have medical housing because we have some people that require more attention because of their medical condition. So we have those housing units, but to say that we house somebody because of their diagnosis, we don't do that.
Thank you.
All right. Well, thank you very much. And Martin, where did you go?
He's behind you.
Thank you, sir. Thank you for what you do.
Thank you.
Just before how many elected officials are on the authority?
There are, how many?
Well, there's one representative from each jurisdiction.
Yeah, so-
Well, you figure, there's one council representative, but also the sheriff from each jurisdiction, which is also elected.
Yeah, so it's 10.
10.
Yes.
Thank you, sir. Thank you, sir.
Thank you.
All right, Dr. Patton,
Yes.
our budget.
You ready? Mayor, Vice Mayor, and members of City Council, this evening as City Manager, I come before you to present the 2020 Budget Strategic Initiatives. The theme for this year's budget is Smarter City, Wise Choices. It is a theme for the 2020 budget. In the presentation this evening, I will share with you the FY 2020 budget overarching themes that are aligned with the City Council's 4 big things. A smart city is a municipality that uses information and communication technologies to increase operational efficiency, share information to the public, and improve both the quality of government services and our citizen welfare. In 2018, Portsmouth became a smart city. Now we move strategically in becoming a smarter city. The budget mantra provides city staff with direction and focus in preparation of the municipal budget. For the past 4 years, the mantra remains galvanized in the preparation of all municipal department budgets. They originally started as the 4 R's, and it appears that each year I add an R, and review where each of the items and each of the budgets, all staff take a formal assessment of examination of all aspects of the budget. So oftentimes in municipal budgets, 1 or 2 things are changed and then it's submitted. But we actually do an in-depth review to the possibilities or intentions of instituting change where there is necessary. I ask the staff to reflect and think deeply and carefully about the goals and formulate cost-effective plans with careful consideration for budget recommendations. And refocus. Focus attention and resources on doing things differently, setting priorities in programs and using different approaches to the delivery of services through combining services and collaboration. And that collaboration is through departmental collaboration in their preparation. The 4th is restore. To strengthen and reestablish attention and resources for all core city programs and service delivery, and provide new energy to maximize the city's resources aligned with the City Council's vision. Reimagine is the new R. And in reimagining, and you can see as we talk about those who came before us, with some of the projects that we're working on today, back in 2006, 2005, that persons had the imagination that things could be done. They may not have come to fruition, but in reimagining, we can form a mental image of something not present in our city. And I can think back when we were imagining that we could have a major hotel in Portsmouth where the Renaissance stands now. And we would stand on that property and think about one day we will get a major hotel, and we did get it. I'm asking staff to rethink it, to believe it, and fantasize about what it is that we want. We will become whatever we reimagine. I probably will not be here when we look at, no, I know I won't be here when we look at what Portsmouth will be in 2030, 2050, as those who came before us and looked at the lakes that they bought in Suffolk that are so important to us financially today. The visioning members of City Council, you collaborative approach looking into the future of our smarter city. Reimagine is a new addition to the budget mantra, requiring all staff to form a mental image of something not present in our city. Rethink it, believe it, fantasize about it. We will become whatever we reimagine. In the budget process, the departments have guiding principles, and those guiding principles are thriving. We draw from our rich history to promote healthy individuals, local economies, regional collaboration, and vibrant neighborhoods with strong identities. Evolving. We embrace the future and respond positively to emerging opportunities to care for the people and places we love by balancing historic preservation with thoughtful reinvestment and redevelopment. Resilient. We prepare for long-term prosperity by thoughtfully creating adapted structures, systems, and practices to prepare for opportunities and to meet and exceed challenges. And equitable. We cultivate a vibrant city while equality is evident as we meet the needs of all our citizens in ways that are fair, meaningful, and empowering. The key components of the staff's financial management process cover 4 important areas, and these key components are practiced throughout the year, not just because it's budget time, but right after budget, we start our budget meetings, and reports are monthly given by the departments on their budget. So this is a year-round process. With the key financial process, key components, we're looking at in budgeting, working and understanding the income the municipality will receive, and balancing its funding with planned expenditures by preparing detailed budget plans and forecasts, which you have had presented to you, the 5-year forecast. Safeguarding, putting in place controls to ensure that the income, capital, and assets, such as money, vehicles, technology, equipment, are safeguarded against misuse, damage, loss, or theft. Monitoring, and that's financial reporting. Monitoring and comparing actual income and expenditures to the budget through regular financial reporting and corrective action when needed. And lastly, auditing, which is accountability, reporting financial results, and preparing accurate municipal financial statements. A part of the budget process is the Capital Improvement Program, which is known as the CIP. And a Capital Improvement Program is a short-range plan, usually 4 to 10 years, which identifies capital projects and equipment purchases, provides a planning schedule, and identifies options for financing the plan. The 2020 budget strategic initiatives for this budget are aligned with City Council's Big 4 things. During the February 1st through 2nd City Council retreat, the Council enhanced and reaffirmed your 4 big things, which are a comprehensive list of strategic initiatives that serve as guideposts in the preparation of the 2020 budget. These initiatives align with a vision in an effort to continue the city's progress towards a more prosperous, lifelong learning, safe, and friendly city. The first initiative aligned with your 4 big things is Portsmouth, the best place for business. We're looking at public-private partnerships, creating a business-friendly environment, reimagining the downtown waterfront, continuing the Crawford Gateway Revitalization Initiative, continue smart city initiatives. As we continue to make strides toward increased economic development while rebuilding and imagining our technological infrastructure, Portsmouth is poised for liftoff. As previously stated earlier in the presentation, a smart city makes wise choices, and we will continue in our efforts at every level to ensure the prosperity of Portsmouth. The vision says that Portsmouth is a prosperous port city that builds on its assets, its strategic geographical location, its waterways, its rich diversity, and is sensed not by happenstance that Portsmouth is located in the heart of Hampton Roads. Those predetermined assets that are previously listed in the vision principle will continue to serve Portsmouth advantage and will be notice in the 2020 budget. The next is Portsmouth, the best place to live. Located in the heart of Hampton Roads, our historic port city aspires to become the best place to live in Hampton Roads, and with additional work, ultimately the state and our nation. In congruence with the vision principles, Portsmouth is a safe and friendly city which values, respects, and protects all of its citizens, visitors, neighbors, and businesses. Smart cities are those that aspire to become a more resilient, livable, sustainable, and inclusive community. In this regard, we will reimagine our current quality of life offerings into possibilities that enable us to enhance the experiences of living in the state's only official Coast Guard city. Tell the Portsmouth story. Portsmouth quality of life offers are as diverse as its citizenry. We will continue to solidify our current relationships and partnerships. We'll work tirelessly to cultivate and nurture new ones within Portsmouth and throughout the region. We will continue to assert our passion for Portsmouth through ensuring that our image and brand represents the best of who we are in the delivery of high-quality services that our citizens so rightfully deserve. Lifelong learning. Education partnerships. The City of Portsmouth City Council remains committed to lifelong learning. The vision states that Portsmouth is a city that fosters education in its broadest sense, from public education to higher education to workforce development, and we will continue to nurture and build partnerships to propel us toward academic success. We know that to reach our goals as the best place for business and the best place to live, providing a variety of high-quality academic offerings leads to careers that yield higher salaries and ultimately increase the median household incomes in Portsmouth. A lifelong learning community enhances citizen engagement, reduces crime and poverty, increases productivity, and affords our citizens every opportunity to become local, regional, and global contributors to our society. If I would walk over for a few minutes, Council. I have broken down all of the, and I don't have my, oh, maybe I brought it with me. I do. All of the items or strategic initiatives that I've shared today breaks down to about 27 PowerPoint presentations that encompasses all of which I have presented today. Portsmouth, the best place for business. We will come back in presentations focusing on economic development, the EDA and PPIC incentives, permitting and planning a new approach to business, and these are topics under the broad topics. Portsmouth, the best place to live, recreation and museums, civic league engagement, the neighborhood partnering program, housing strategic plan, Poverty Task Force, bike and pedestrian enhancements, downtown placemaking, Crawford Gateway revitalization, smart city, waterfront development, and a resilient community, focusing on economics, climate change, and recurring flooding. Tell the Portsmouth Story will encompass presentations on marketing, city attractions, which include some of our places that are very much attractions: Botawee Golf Course, Union Bank and Trust Pavilion, Children's Museum, special events. Campaigns such as I Am Portsmouth, Portsmouth Proud, tourism, city-wide engagement, and lifelong learning. Coming back with presentations on Portsmouth Public Schools, Tidewater Community College, private and home schools, higher education, workforce development, municipal fellow internship program, and youth careers. The Mondays will be very heavy with presentations. As you know, we taper our Tuesdays meetings so that we can be in, you can be in your meeting at the 7 o'clock hour. You will receive before week's end a schedule of each of these and how they will be presented. Questions?
Questions for Dr. Pat?
I love it.
I do have a couple of questions and comments. One, it would be useful to start our thinking with that comparison of Portsmouth to the other cities in Hampton Roads, both the south side and the peninsula, where we compare all the taxes and fees that are paid.
We can already do that now. That's the presentation.
Okay?
Okay.
She's good.
Okay. You ready?
And second,
Okay.
just to get a feel for the lay of the land amongst our colleagues,
Okay.
is there any desire to increase or decrease, or any desire to increase that bottom line comparison? I think I know the answer.
Let's see.
In other words,
I'm not sure what the question is.
it's a trick question.
Yeah.
Before we go up on any fees,
No.
Well, could we present, Mayor, and look at our comparisons?
I'm trying to give you a little bit of,
We were going to come back. What we are doing is showing the comparisons. And then we're coming back to you, and where we will give you some range of, as we've done before. And then you all kind of say, go down,
some
go up.
budget guidance, that we would like to see this budget balanced in
Yes.
such a way that it does not have a tax increase, just to
Well-
put it plain English.
Right. Mayor, Vice
Does
Mayor.
anybody want a tax
No,
increase?
no, I don't want one either. Mayor, Vice Mayor, members of City Council, this is my fourth budget, and how 4 years pass so fast. Today is my 166th day of my fourth year. But one of the things that since coming into this position, when you're seeing the things that we're asking department heads to do, that work is actually being done. No one on my team can ever say that I have had one conversation or approached them in the process of, I know, but I'm
You don't
saying,
have to defend yourself.
we don't want to raise
We're just
taxes.
going to give you guidance in the front.
Yeah, good.
Okay.
Thank you. All right,
Okay.
we will have Mrs. Washington now to come forward with the presentation on revenue, local tax, and fee benchmarking review.
Thank you.
Okay. Yeah, nobody wants to raise taxes.
Somebody need a pen down there? No.
Mayor Rowe, Vice Mayor Lisa Lucas-Burke, and members of City Council. Tonight, I will be presenting key benchmarking data, which is instrumental in decision-making for the upcoming FY 2020 budget process. The Government Finance Officers Association recommends the following best practices, which are included in the city's financial policies with reference to development of revenues for each budget year. The city will strive to maintain diversified and stable revenues streams to protect government from problematic fluctuations in any single revenue source and provide stability to ongoing services. Revenues will be budgeted conservatively to minimize shortfalls in individual revenue accounts. Staff will develop revenue estimates based on historical collection patterns and economic trends. The first slide, a penny on the tax rate. And we have used this slide in our community engagement sessions for the past three budget years. For FY 2017, 1 penny on the tax rate generated $700,000 in general fund revenue. In FY 2018, $723,000. And what we're projecting in FY 2019, $748,000. Therefore, on a positive note, we are trending upward in our real property assessment growth over the past 3 years. Measures of tax burden and variables that affect revenue and expenditures. Portsmouth ranks number 13 as compared to our peer cities of Norfolk, Hampton, and Newport News. You'll see there 14, 15, and 16. The highest percentage of tax-exempt property, the highest dependency ratio, dependency population under 18, 65 age and plus. You'll see Portsmouth's at 37.3%, Norfolk 30.1%, Hampton 35.5%, and Newport News 35.1%. Still, the city imposes a comparable or even lower tax burden in the context of income for two commonly cited measures of tax burden, which is the per capita local revenues as a percentage of per capita income and real estate taxes as a percentage of median household income. Average annual growth rates in consumer revenues. Consumer revenues have generally recovered from the recession. However, general sales represents the only consumer revenue that is approaching its long-time average. Hotel revenues continue to underperform long-time average, and part of this is due to the statement regarding the closing of one of our flagship hotels, which was the Holiday Inn. So you'll see that for the long-term average was 5.3%, but our recovery period, 2012 through 2018, we're at 0.5%. Average annual revenue growth rates for our property, other local taxes, other state and federal. For property and other local taxes, which comprise 70% of the general fund, we continue to underperform with the growth rate from 1990 to 2010. If we were to achieve the total annual growth rate from that same time period, the city would have been realizing an additional $8.2 million in recurring tax revenue.
It's amazing.
This is real estate appreciation, actual growth versus Shiller. And Robert Shiller is actually an American economist from Yale University. So we have used his data regarding the 3.35%, which represents the long-term average for real estate appreciation. And that is the red bar line that's going across. The accompanying graph illustrates the real estate market fluctuates with the economic cycle. Dr. Patton will speak to the spike in 2007.
Right. Mayor, Vice Mayor, members of City Council, those of you who were here remember that in 2006 and 7, the city hosted its first Home-a-Run, where the homes were built and the $1 million homes that were a part of that, which created such a spike. At the same time, the city built 10 Habitat for Humanity homes in 1 week. And we, doing our research looking back, that was a part of what the spike was.
And this sort of illustrates some of the revenue growth when we talk about the city, that we're really over the past 3 to 4 or 5 years would be under the 1% regarding revenue growth, which equates to maybe about $1 million and $1.5 million over the general fund that we have to provide to all of our city services and departments and even to schools. state general revenue versus state aid to Portsmouth. The recession forced the state to reduce spending, including aid to localities. Since the recovery began, the state's revenue growth exceeds the restoration of aid to Portsmouth as shown in the graph. And the red line going across is the state aid to Portsmouth. The blue line going up, you'll see the gap is the revenue growth for the state general fund. If the aid to Portsmouth matched the state's rate of revenue growth, the city would have been realizing an additional $5.8 million in revenue. Cigarette tax revenue per penny. Numerous factors contribute to the declining trend in the revenue: health awareness, non-smoking legislation, cancer litigation, price increases, e-cigarette purchases. However, quitting smoking is a good thing for our community. Has very good societal and health benefits. If Portsmouth had maintained the 2004 per penny revenue generation of the cigarette tax, the city again would be realizing an additional $1.8 million in tax revenue. (2019) comparative tax rate for our 6 peer cities. Portsmouth, as you can see, we have the highest real estate tax rate at $1.30 compared to our neighboring localities. We also have the highest on personal property at $5 per hundred. And in cigarette tax, we're the second highest, with Norfolk being the highest at 95 cents. Portsmouth's at 95 cents, and our neighbors are at 85 cents, Hampton and Newport News, with Chesapeake, Suffolk, and Virginia Beach sort of in that same alignment. Meal tax, Portsmouth is probably one of the second lowest, not lowest, but within the range of Hampton and Newport News. They're at 7.5%. Portsmouth and Norfolk are at 6.5%. Chesapeake, 5.5%. Suffolk, 6.5%. And Virginia Beach, 5.5%. We're all in alignment on our hotel tax at 8% for the region. And in the hotel occupancy tax, I'll have Dr. Patton speak to that. Yes. And also on the meals tax, I'll have her speak to that.
I cannot answer why the city never instituted, in fact, talking with one of the city managers, when I said we do not have a hotel occupancy tax. He said, no, you looked at it wrong. You have to have at least $1, but Portsmouth has never had. If we had $1, that would bring in $120,000. That's what we would estimate right now. But you look at our city across the water that has a $3 hotel tax, and that's one that I'm choosing to come.
How you fund your tourism and marketing.
That's true. I'm choosing to come to the hotel I'm going to stay, and there's a $3 charge on. I don't think that's going to prohibit anyone from coming to our hotel. So this is just something that we're looking at. When we look at the meal tax, of which we are not the highest, if we were in comparison with Hampton or Newport News, that would bring in an additional $1.3 million a year. But these are just showing you the comparatives of the tax rate across the region.
What's the highest allowed by the state on the cigarette tax?
I don't think there's a limit.
I'll have to get back with you, Councilman, and I'll get that back to you no later than tomorrow. But I do think there is some cutoff relative. So it is. I want to say that 95.
The 95 might be the ceiling.
He thinks it's 95.
I don't ever recall any discussion on any council I've been on of a hotel occupancy tax. None.
And it's been 20 years.
Well, if we had had it all these years, we surely would have had some money, more money.
Well, let's get it now.
So these are just showing you, and we're going to be working the budget. These are just showing you. When we're going to come back to you, and you will be able to kind of weigh in on what we would propose in the range. Okay.
Okay. This is the real estate tax rate per penny revenue. It sort of speaks back to the slide that we were looking at before regarding generation of a penny, what it is for Portsmouth. And this is a very telling slide because if you look at Portsmouth, we're at about 748,000 per penny. Our tax rate is the highest at $1.30. And if you look at our other neighboring cities, they have lower tax rate, but their generation of revenue is higher. And one of the bigger factors is because we have up to 50% of tax-exempt properties. So if you go all the way to Virginia Beach, even though it's about $1 for their tax rate, they generate upwards of about $5.8 million just for 1 penny. The same thing with Newport News and Hampton. Even though their rates are lower, the generation of 1 penny increase on their tax rate generates about $2 million. So in our neighboring cities, even though the citizens talk about the lower tax rates, we have to do more to generate more for in order to pay for our services for the city.
Sure.
Next step, as Dr. Patton mentioned in the previous presentation, we will be reviewing fees and rates, benchmarking analysis, looking at all funds, and using this data and analysis to make determinations for financial impact for the FY 2020 budget.
All right, any questions?
Would it be a comparable thought that if the addition, when the G's group came in and did all the Homerama property, that with the Ryan Homes activity in Craddock, I know that's not $1 million homes, but it's a lot of properties. As that comes online and some of the other development around Newport, that we'll see some additional residential real estate tax just by sheer numbers of volume of additional homes being built,
Sure.
new homes.
Absolutely, and that's what we need is inventory right now. We're struggling to get new
But
inventory.
none of that's going to help us in this
No.
fiscal year.
No, not
It'll
this
be probably into the next year before that matters.
next year. Right.
What we need, where I was going with my question,
Okay.
from time to time, the city manager is asked by city council to do a comparison of the total amount of taxes and fees, to include the sewer fee, the water rate. And in fact, it was so good that we published it a couple of times in our Virginian Pilot tab. And it shows us, if you live in Portsmouth, you pay this much annually. If you live in Chesapeake, you pay that much annually when you take into consideration. Can you resurrect that table and make it current for this budget year? So
We can.
Yeah.
We will. We've had
We have
that
that.
for each of our budget years, and we
Yes.
will do it again this year.
That is very helpful.
Yeah, and if we could have it at the front end.
Okay, we
Yeah.
can have it, or we'll have it at our next meeting.
Are there any other questions? Thank you so much.
Thank you.
All right.
Mayor, Vice Mayor, members of City Council, we're going to have Mr. Sweats to come forward to present to you the 2020 census report back, which is the calendar.
Good evening, Mr. Mayor, Madam Vice Mayor, members of council. Thank you for having me again to speak about the census. I want to talk to you, excuse me, about what we've come up with for what we think a calendar should look like for the city going forward as we go try to complete our census over the next year and a half or so. We've divided this into essentially two parts: what we want to do this calendar year, what we want to do next calendar year. This calendar year is mostly about planning for the census. Next calendar year is more a little bit about action and what we do to get people counted. So the first thing that we need to do is we need to have a complete count committee created by you all. We are estimating somewhere around 25 people would be on that committee. That does not include yourselves and does not include city department heads. Instead, we're thinking about people that you all may know or that the city might be aware of that know lots of people or who have the ability to reach out and engage with a lot of people. So I would imagine that would really include members of faith-based communities, pastors and ministers, leaders, business leaders, civic league presidents, schools, principals, or PTA members, things like that. Anyone who has that ability to send out an email, to make phone calls, you picture that kind of tree in your mind of everywhere, that word can reach, to let people know that the census is coming, try to dissuade your fears of giving their information to the government. Once that committee is created, they need to meet and they need to start creating their own internal structures, appointing a chairperson, deciding on when they should meet, figuring out if they want to have various subcommittees, looking at things like reaching hard-to-count populations. After that, we need to start advertising that there will be jobs available working for the census. This is especially critical, as I found out when I tried to find if there were actually any jobs available. And you'd be surprised to know the government is not really good at making sure that multiple groups are talking to each other. So there are multiple census websites that give you completely different information. So part of our job in advertising the census out there is making sure we're directing people to the right places so that we can take advantage of those jobs that Mr. Craigfield talked about when he came to speak to you all a couple weeks ago. And then lastly, the federal government will start their formal advertising efforts in December. Again, that's something different than what they say on their website, but our job will be to start piggybacking on that, and we imagine that that will really start happening in 2020. So once we get into the new year, we'll start creating what we're calling ambassadors, people who hopefully will go out into the community, especially at special city events and such, to let people know that these are happening. We can put together mailers to say give to churches to put in their bulletins, advertising along traditional city lines, so with social media, email, and such. We also need to work with the federal efforts to make sure that we're, again, giving the same information that needs to be out there, not directing people to places where we're getting bad information. We need to keep advertising that we are looking for employees. I would imagine, although I don't have confirmation of this, that in 2020, that's when they'll start, the government will start hiring people to be what they call door knockers, the people who actually go out and knock on doors and let people know that, please, you need to respond to the census. This will be especially critical for us because, as was told to us by the census officials a couple weeks ago, the effort here is to be entirely electronic. They do not want to be in the business of giving out mailers. They don't want to be in the business of hiring people to go door to door. That costs money. It's a lot cheaper if you get on your phone and call, or if you get on your computer and do this all yourself. So those types of efforts are going to be things that start coming around at the last minute. On March 20th, after the self-reporting begins, when people go on their phones or go on their computer or what have you and start filling out the census for themselves, then we can start using this response outreach area mapper, where we can look at communities and find out where are we not getting the responses that we anticipated. And that's what I imagine is how the census will then hire door knockers to go into very specific locations. But for a community like ours, where we have a lot of people who don't have access to the internet, who don't really even have, in some cases, even have phones that they could pick up and call someone to fill out the response over the phone, this is going to be critical for us to make sure that we are targeting our resources specifically in the right areas. The census ends on August 31st. A report is due to the president by December 31st, letting him know what the official tally is. And then in April of 2021 is when an official report is due to the states to let you know what your census is to figure out congressional reapportionment.
Right.
I'll be happy to take any questions at this point.
Your recommendation, Dr. Patton, is 25 members on the complete count committee?
Yes.
Were you able to find out what the size was for the previous census?
I haven't found any record of
Yeah.
one.
To my colleagues on council, does 25 sound good?
Yeah.
Sure.
Sounds good to me.
Mr. City Attorney Solomon, should we create this by resolution?
Yes.
Okay, can you all prepare a resolution to bring back at our next meeting that creates the complete count committee and set forth its responsibilities in the resolution so that we can adopt that and get this committee up and running? And we talked last time about you working into your budget an amount for the census, budget amount for the census.
Okay,
In
for
case we
advertising,
have,
all kinds of stuff we have to do.
Yeah.
Mm-hmm.
we have consensus on this.
Yes.
Okay,
Yes.
all right.
And Mayor, we would ask that you all begin to think in between of people, and as the staff has been saying, these are going to be worker bees.
Sure.
These are going to be worker bees, and they'll have subcommittees, they will probably bring people on to help, but this is a full-time.
So if you could put that on the agenda for the next regular meeting,
We'll have
not
it.
tomorrow, but
Okay.
is that good for everybody?
Yes.
Okay.
Mayor, that concludes my presentation.
All right, let's go back to the jail. I apologize for the passing of the notes back and forth, but let's make two assumptions. One, that the current jail is operating on high efficiency. And two, that we don't have a regional jail. I'm concerned about the safety of a building that was built 55 years ago. And the standards, the building code, we didn't even have the building code that we have today in 1965. With the consensus of council, I'd like for us to ask the city manager to see if there's some way that we can evaluate the safety of that building. We closed the courthouse, which was built at the same time, because we deemed it to be an unsafe building because of fire problems, because of asbestos, because of mold. And so we need to be just as concerned about the current jail. It can be the most efficient operation, but if it's lacking something that doesn't need code, I think it's incumbent upon us to know that. So
Yeah, we're talking about the physical facility.
exactly, the building, the
Or
bones.
the physical, not the physical, the physical.
Yeah.
I'm not understanding. Can you repeat that?
Yes, we're looking at a building that houses people overnight, that was built 55 years ago, before the current building code was enacted.
Yes.
Okay? The question is, how safe is that building? It has nothing to do with the regional jail. It has nothing to do with the way that the jail is operated. It has everything to do with how safe is the building. Does it have asbestos? Does it have mold? Does it, if we had a fire in the building, can the fire department get water to the top floor?
I can't answer that.
Yes, sir.
Well, Mayor, I think based on, what you just shared, an assessment of all those things you just indicated, I think is prudent. It makes a lot of sense.
Okay. Dr. Patton, you got any questions on that assignment?
No, sir, I don't
Okay.
have any questions.
Bill? I'm sorry, your finger go up.
Not about
Okay.
not about this. I agree with the need of assessment, safety.
All right.
I have an issue after you.
Go ahead.
Good. Colleagues, I guess y'all got my email. There's one issue that we've certainly been, those of us who've been on council for the past 2 years have been discussing. And it's really time, as we enter the budget season, to make a decision. Hopefully that decision is a consensus. And what I'm talking about is the adjustment, across-the-board adjustment for our public safety retirees and widows. As we've heard, the General Assembly deal with firefighters, the cancer issue. I don't think it's a stretch to say probably some of these widows are widows because of because their husbands or significant others probably succumbed to cancer that was job-related. We also know that in the past 4 years, this group has not received any COLA increase. And if they would have just taken the $10,000 retirement of an average widow, that would have amounted to about $25 per month. So the $100 is really, I think, is needed for them. Also, I think it's the right thing for this council to do. And I'm convinced more than ever after our retreat that this council is about doing the right thing. So, Mayor, what I would like to see is a consensus to have the city manager come back with a line item in the budget, not taken out of the retirement fund, but in a budget to do the right thing by doing this across-the-board adjustment of $100. I'm obviously on board with it. Hopefully we have a consensus to do exactly that.
All right, any questions on what Bill's proposing?
Are you, yes, there's
All
my
right.
question.
Okay.
Are you asking us to agree to know what the numbers are?
Now, we know what
Or-
the numbers are.
Or are you asking us to agree to put that in the budget?
Agree to put that in the budget.
Okay, that was my question.
I'm not sure that all of us know what the numbers are. I mean,
I don't.
particularly our new members of council. Shannon, do you know? Paul, do you know?
Educate us on the numbers.
700,000, 800,000 yearly.
771,000.
Forever and ever and ever.
And I'm glad you mentioned ever and ever. You know, this group came out of our healthcare system about 3 years ago, I believe, and at a substantial savings to the city of approximately $800,000, and that's reoccurring. You know, municipalities like to talk about reoccurring expenses, but a savings, unless you're going to duplicate it in a reoccurring expense, that is reoccurring. So I'm asking for a consensus tonight.
Was it 710, did you say?
771.
One penny on the tax rate? All right, colleagues, you ready to discuss this?
Sure, I'm ready.
All right, go ahead.
I cannot agree at this point to a permanent addition to one group of retirees. We have, with all our retirees and with our own active duty working employees, we have been giving bonuses or stipends or one-time only checks for the last several years in order to not affect the long-term situation with our retirement funds. And I think until our retirement systems are in a better position financially, I can't agree to that. I'm happy to take one-time money, which I think in the case of particularly the widows and the retirees from the 60s and 70s that are still around, that's more money for them, more effective money for them when they get $500 here or $1,000 there than any, percentage of or whatever.
Excuse me.
I can't agree to that right now. Not in this financial situation we're in.
Paul?
I'm going to agree to it.
Okay.
I do agree to it, but, I want us to be able to take a look at it all because, I'm concerned about the schools, allocating funds for that as well. So, I mean, if these are the actual numbers and it only includes the fire retirees, then how do we account for all of the other retirees too? That would be a concern, and I know we don't have a lot of money. I would be on board with it, but, I didn't realize that this number was this high, so.
You say that you want to think about it in the context of everything.
Yes.
Okay. Nate?
I think it's, until we get the budget proposal from Dr. Patton, that's when the discussion should start.
Similar as.
Yes, just some on a presentation.
Right. So from what I've heard and what I know of this part of it, I'm going to agree to it. And I'm also going to leave a caveat with that, saying when we do get the budget back from the city manager, it will be our responsibility to look at all the areas to see how we can impact what we need to do. So, but I'm going to agree to this.
Context. Did I get that right? Paul, what?
Yes, I agree to it, but let me say this, Mayor. Nobody hates taxes more than I do, but I know we don't want to have to raise taxes. I know how the citizenry think about it, but sometimes you have to, look at making some tax increases, and maybe we need to look at that as well. There's a variety of ways that we can raise taxes without raising alarm and fear and a lot of disgust among our citizenry. And there's a lot of good that can come out of us having the courage to raise taxes.
Okay. I think it's early to be talking about putting something in the budget. That I think it's more appropriate to look at it within the context of the total budget. I have concerns about equity, about how you treat all the retirees, not just this one group of retirees.
That's my
And-
point. That and the financial end of it.
Yeah, because we have two closed retirement systems, and we've got elderly members in the other retirement system that probably are suffering, if that's the right word to use. So I have a hard time saying yes to this out of context and saying yes to this without understanding the whole equity question that I just discussed. So it looks like to me we might have a majority of council saying, let's look at this in the context after the budget has been introduced.
Tell us what this really means.
Yeah. Is that,
What does it mean for everybody, and what does it mean next year, and what does it mean 5 years from now?
Well,
you may,
if I may, I think after the budget presentation, I think it does a disservice to staff. If we're going to discuss it in a broader context, I think the budget staff workers would like to know that going into it and say, okay, this is budget with that option, this is the budget without that option. Once they present the budget, I think those of us who've been through enough budgets know it's a lot more difficult to change something at that point in time. The template is pretty much set.
And Ms. Washington, I mean, she gave us some good options on increasing meal tax and hotel tax, and, if we could take a look at those, this is my context, I would be, willing to, but I want to try to look at everybody, the retirees here, the fire, our school, because we've had, years where we've done nothing in those areas too. So I would like to take a look at, where we can make those increases and see if we can make it happen, so. Yes.
one last thing. Even though it comes out of the general fund, we need to determine whether or not, if it goes into perpetuity, does it become a liability as it relates to OPEB?
That's what we were saying over here.
And you can research that and bring it
Yeah.
back, because if it
We know.
becomes a liability, we're fooling ourselves up front.
Right.
Okay, we know.
thank you for bringing it up. And just without question, we've got some people that get very, very meager retirement checks, but that's in both retirement systems. Okay? Anything else?
No, sir.
All right, we'll adjourn this meeting, and we'll reconvene tomorrow at 5.